Welcome to After Speech Therapy in our Get Ready for Successful Speech Therapy video series. In this video, we'll talk about what to expect at the end of speech therapy. My name is Nancy. I'm an Alberta Health Services pediatric speech language pathologist, also called speech therapist. Eventually, your time with your speech therapist will come to an end. Your child may not need to see their speech therapist regularly anymore. So what happens next? When you plan for speech therapy, you start by setting a goal. Your speech therapist will help monitor and track progress towards your goal and help you adjust as needed. For every family, there will come a time when you will move away from regular sessions with your speech therapist. You and your therapist will develop a follow-up plan. The reason for moving away from regular sessions will be different for every family. First, your speech therapy might come to an end because you've achieved your goal, and there's no need for ongoing speech therapy. You may need a break from therapy for a while. During your time with your speech therapist, you'll be learning a lot of strategies to help your child work toward their speech goal. Many parents get to be very good at using the strategies themselves. You get to a point where your child just needs time and home practice for the skill to generalize. So you can take a break from speech therapy sessions and keep working towards your speech goals at home. Often, when you take a break in your regular sessions like this, your speech therapist will talk to you about doing a follow-up visit. It might be in a few weeks or even a couple of months. Sometimes, when you're working with an Alberta Health Services speech therapist, your child's care may be transferred to another speech therapist with a different agency. For example, you may be able to access speech therapy at daycare or school. Services available outside of Alberta Health Services vary from place to place, but your Alberta Health Services speech therapist can assist you with the transition or change in service providers. There may be times when your priorities change, and this may be a reason to end your speech therapy sessions, and that's okay. For example, you might choose to focus in another area of development for your child, like physiotherapy. Speech therapy can be put on hold or stopped if that's what's right for your family. Talk about the things that stand in your way of speech therapy with your speech therapist. They may be able to offer help or offer suggestions. For your last visit with your speech therapist, have or make a plan for what to do next. For example, will you check back after a certain period or maybe in a few months? Or if your child has achieved their goal, be sure to know where to go if you have questions about their speech in the future. If you have any questions about any of the information you've heard, talk to your speech therapist, family doctor, or healthcare provider. Thank you for watching this video series. We hope you're feeling prepared to make speech therapy successful.